guys, let's talk about the pubic joint and ligament. So the pubic bone has 4 major joints. It has 2 sacroiliac joints. It has a sacrococcygeus joint and a pubic symphysis, which is also a joint. Okay, now take cues from the names of the joint. If you say sacroiliac, where does it start from? It's a joint between the sacrum and the ilium. Okay, if you say symphysis pubic, it's the joint between the 2 pubics. And if you say sacrococcygeus, where is it from? A joint between the sacrum and the coccyx. Okay, so now look at this one. We have this as the left sacroiliac joint between the sacrum and the ilium. The right sacroiliac joint, making 2 sacroiliac joints. Now on the sides of both the ilium and the sacrum, they bore depressions and elevations such that they lock up, okay, into some kind of a dorsal kind of spasm. Okay, and because the pelvis transmits weight, okay, this joint is very strong, so that it's able to do that job perfectly. Now you see, even though it's very strong and looks firm, at the level of S2 there's some sort of a slight movement, but overall this sacroiliac joint is very strong. Then over the joint we have what we call the sacroiliac ligament. Okay, there are other ligaments as well. We have what we call the sacrospinous ligament. Look at the name. It means that the ligaments extend from the lower portion of the sacrum to the ischial spine. That is called sacrospinous ligament. Okay, then we have another one called the sacrotuberous ligament. Where will that one come from? It's from the lower border of the sacrum to the ischial tuberosities. Are you getting? Yes, so the sacral and spinous ligament, the sacrotuberous ligament, helps hold or join the sacrum to the innominate bone. Okay, and they allow for just minimal movement. Now we come to the symphysis pubis. The symphysis pubis is a secondary cartilaginous bone joint. Okay, it's approximately 4 centimeters in length. When you look at the articulating part of the 2 pubic bone, we have a hairline cartilage here, and also it is joined, or the 2 pubic bone are joined by a fibrous cartilage. Okay, so it will join them together as one. Now over the symphysis pubis, we have a ligament called the pubic ligament, and the pubic ligament allow for very minimal kind of movement. I hope it's clear. Now we'll move on to the sacrococcygeus joint. If you say sacrococcygeus joints, I said earlier that is between the sacrum and the coccyx. So the lower part of the sacrum and the upper part of the coccyx. Okay, that is that joint. Now over this joint we have what we call the sacrococcygeus ligaments. Now this joint allow for some form of extension and flexion, backward forward movement. So it helps us in defecation and in labor. So in labor, at the outlet area you could have the coccyx tilt back, okay, because of the sacrococcygeus type of joint. I hope you get it. Yes. Now aside that, we also have what we call the inguinal ligament. The inguinal ligament is from the anterior superior iliac spine to the pubic body. So from here we have a ligament called the sacro we have a ligament called the inguinal ligament. No, the sacral has released that. So like inguinal, from anterior superior iliac crest, iliac spine to the pubic bone. Are you getting? Also, we also have what we call the obturator membrane. You remember the obturator foramen, which is this one. We said that it is covered by obturator membrane, except for the portion where blood vessels pass through. Okay, now all these joints increase their power of movement during pregnancy. Why? Because of the action of the hormone relaxin, it increases the laxity of these ligaments that we have spoken about, okay, thereby increasing the power of movement of these joints in pregnancy. Thank you for watching. Now in our next video we are going to talk about the pelvic floor muscles. Put in the comment section the type of pelvic floor muscles you know and any part you can identify. Until then, bye.